Hello dear friends, hello dear viewers, welcome to my YouTube channel Usama Askad Vlogs. I hope you all viewers will be fine and doing well. Dear friends, dear viewers, here in this video I will discuss the different terms, different planes. Also I will discuss the terms which is related to the moment. Before starting my video here, I can request you to please subscribe to my YouTube channel Usama Askad Vlogs. Dear friends, the term superficial and deep denote the relative distance of structure from the surface of the body, and the term superior and inferior denotes levels relatively high or low with reference to the upper and lower ends of the body. The term internal and external are used to describe the relative distance of a structure from the center of an organ or cavity. For example, the internal carotid artery is found inside the cranial cavity, and the external carotid artery is found outside the carotid cavity. The terms internal and external. The term internal and external are used to describe the relative distance of a structure from the center of an organ or cavity. The term ipsilateral refers to the same side of the body. For example, the left hand and the left foot are ipsilateral. Collateral refers to opposite side of the body. For example, the left bicep brachii muscle and the right rectus femoris muscle are contralateral. The supine position of the body is lying on the back. The prone position is lying face downward. The terms related to the movement are: a site where two or more bones come together is known as a joint. Some joints have no movement. Sutures of the skull, some have only slightly movement. For example, superior tibiofibular joint, and some are freely movable joint like shoulder joint. Flexion is a movement that takes place in a sagittal plane. For example, flexion of the elbow joint approximates the anterior surface of the forearm to the anterior surface of the arm. It is usually an anterior movement, but it is occasionally posterior. As in the case of the knee joint, extension means straightening the joint and usually takes place in a posterior direction. Lateral flexion is a movement of the trunk in the coronal plane. Abduction is a movement of a limb away from the midline of the body in the coronal plane, while adduction is movement of a limb toward the body in the coronal plane. In the fingers and toes, abduction is applied to the spreading of these structures, and abduction is applied to the drawing together of these structures. The movements of the thumb, which are a little more complicated, are described on page. Rotation is the term applied to the movement of a part of the body around its long axis. Medial rotation is the part of facing. Lateral rotation is the movement that results in the anterior surface of the part facing laterally. Pronation of the forearm is a medial rotation of the forearm in such a manner that the palm of the hand faces posteriorly. Supination of the forearm is a lateral rotation of the forearm from the pronated position so that the palm of the hand comes to pass anteriorly. Circumduction is the combination and sequence of the movements of flexion, extension, abduction, and adduction. Thank you so much for watching my video. Please like my video, share it with your friends, and do subscribe to my YouTube channel Usama Askat Vlogs. Thank you so much. Goodbye.